EM Weekly starting right now, bringing emergency managers from around the world together to learn, share and collaborate.
Hey, that was a odd ending to the intro, but that's cool. Hey, good morning, everybody, and my name is Todd DeVoe. I'm your host of the EM Weekly Show, and I'm excited to have everybody here. And today I have Dr. Chanel Fischetti, and we are going to discuss how the medical community is approaching COVID and the possible timelines for treatment and what's next in the steps of the battle against COVID-19. And so Chanel is an ER doctor who's a certified chief medical officer for, I'm going to kill it, Centra Labs. It's a company that does medical database and things like that. And I let her explain that a little bit more. And thousands of skilled annotators to enable artificial intelligence in other companies and hospitals. So it's kind of cool. So right, it's in that AI realm of things, technology. And you guys who listen know I like the technology stuff. It's really kind of cool. And yeah, and she's also a not only is she a working medical doctor, she also is a professor, and she's joining the Brigham and Women's Emergency Department as a clinical instructor, and while continuing to work at the labs. And she's passionate about medical entrepreneurship and leadership in both clinical and non-clinical capacity. And man, how are we going to get out of this COVID mess?
I know it's been crazy because I've been on both coasts now during the pandemic. I feel like I'm chasing COVID. Obviously a vaccine will shorten this whole crisis in general, but I think realistically, it's not going to be until 2021 till we get there. I think the hardest part, honestly, is health literacy of the general population. I've noticed now working on both the East and West Coast in the last 6 months, the populations hardest hit are either the more uneducated or the poor population. So I think educating the public is going to be a huge part of what we do as healthcare providers. And I think that will help hopefully stop the spread. And I know that there have been a lot of like national and international campaigns in terms of wearing masks and washing your hands, all of that. I think that will help slow it. But ultimately, I don't know. It seems like at some point we'll all be exposed unless there's a vaccine, just at the rate that it's going. But I think that being said, what I always try to do every single time I have a patient, I want to make sure that everyone knows, like, not every scenario is New York City. I especially where I'm at in the West Coast, I discharge 95% of my patients. So that means just because you do get COVID doesn't mean this is the worst case scenario. And that's, it's obviously not ideal to be sick, but that's something that I think should be reassuring also to patients, that this is also an illness that people do overcome. Absolutely, not ideal, but.
So I got sick back in February, right? And I tell the story because I think it's interesting. I not that getting sick was interesting, but this part of. So I went to a conference. I get back from the conference, and I get nailed by this thing, whatever it was, right? And and I have some medical background, so I kind of know what to do. I moved my daughter into my room. I took over her bedroom. I isolated myself. We kind of did that type of thing, keep the rest of the family away from it. And I'm on the phone with Brian, who's the producer of the show, and he's like, dude, you sound like you're wheezing. I'm like, no, I feel okay. So I finally go get checked out, and the doctor's like, hey, we're just going to go ahead and treat you like this. It's probably the flu, because we could test you for flu if you want. And he goes, but we're having all these people coming in that are sick and they're getting the same symptoms, but they're not coming positive for flu. So this is just, he goes, we're going to give you Tamiflu. We're going to do this. And, I went out the door, and I was like, I was like, okay, great. Were we really in COVID at that point, do you think?
I think that we've been seeing COVID for longer than what we've even been able to test for. At the time when COVID first hit the East Coast, I was working in Connecticut, on the border of basically New York, and then also in the middle of Connecticut, at two sites. And I'm sure I saw COVID patients. We weren't even allowed to test in Connecticut until like late March for it. Like the resources weren't available. And then there was this period where you weren't even allowed to test someone unless they told you they had come from Iran or China or Italy. And so, the likelihood that I've seen patients, because I definitely did swab patients that were negative for flu, but like really sick still, we weren't really alerted to it, at least as a healthcare community, in terms of what we were even allowed to do until probably March. So the likelihood that people had it in January, February, even maybe December is very probable. It's probably been around a lot longer.
Yeah, and what I find interesting about this idea here is like I traveled from California, I went to Daytona, and then I had an issue with a flight. There was actually a big storm came in, so the flights out of Daytona were canceled. So I rented a truck. I drove to Orlando, went to that huge airport, contacted. I was thinking to myself after going through, like, oh my God, all those contacts that I had through all that, I mean, I always think of the movie Contagion, right? And as it's a movie, everybody know this. Hollywood's associated with it, but I was talking to a couple of epidemiologists, and they said that's a pretty spot on film as far as like not the medicine necessarily, but the epidemiology portion of it. How can we stop the spread? I mean, one guy, myself, traveled all these places, had all these contacts. I mean, outside of shutting down the economy like we did before and complete travel and have everybody stay at their home, how do we ring this in?
Yeah, I mean, I'm not an epidemiologist, but at this point, we were such a globalized society, and we still are, but obviously we've reduced that within the last few months. It's hard because travel technology makes it so easy now.
Right.
And to some extent, I think everybody's trying to do the best they can do, like wearing their masks, washing their hands, but people are people, and they still are social people, and they want to be social. And, I think people did a good job of quarantining for like 2 to 3 weeks, 4 weeks, sometimes depending on the state. And then people got over it. And now they're like kind of trying to get back to some, whatever new normal looks like. And so in that sense, travel will probably pick up. People will want to be social. How do you stop the spread? I mean, obviously, if you didn't move at all and you just stayed in your little bubble, like that's the most surefire way. But I mean, it's hard to force people to do things sometimes, and not everybody's living as others. So I'm a firm believer that if you wash your hands before you touch your face or put anything to your mouth, like water or food, that's so beneficial in so many ways that I think people really underestimate.
Right.
So in terms of stopping the spread from that capacity, like being as clean as you can. But I don't know. It's a really, really challenging disease to stop the spread on.
For sure. I can tell you one thing. Kids these days, like my daughter and her, they're gonna know how to wash their hands like anything else, because every time she washes her hands, she does her little song. She sings the ABC song, and makes sure.
Oh, that's good.
And it kind of makes me laugh because it's a habit for her now. It's not even just like like where you just go wash your hands really quick. And I always equate it to, like, I remember when I was working in the medical field where we had that little light. Right? Do you guys still have that? Right?
When it like turns green and you're good.
Yeah.
I haven't seen those recently, but yeah, that's a good idea to probably reinstate.
Yeah, wash your hands. You got the little scrubber. You got to make sure. So yeah, everybody, even doctors have to be reminded how long to wash their hands. Just to let you know.
Oh, for sure, for sure.
So how can emergency management or public policy, for that matter, support what you guys are doing on the front lines as medical doctors?
Well, I mean, obviously there was a time where PPE, I mean, in some places this is still an issue, but actually probably all the places I've since worked, PPE is still an issue. I very often recycle my masks. There's at basically every hospital I've been at so far. So PPE, if there was more support there. Health literacy is something that I spend a lot of time on with patients with discharges. What does it mean to quarantine at home? What does it mean to like wash your hands every single time that you want to eat or drink? And you're seeing a spectrum of, socioeconomic classes, educational classes, and So I think if we did a better job of educating the public, and I know we're trying, but and you can't, say a blanket statement and assume that everyone's going to understand everything. But I've noticed that that's been a big issue. The reality is too, is that a lot of the poor communities, have been very hard hit, and that's definitely been brought up several times. I know in various capacities that like the poor communities are getting the hardest hit, partially maybe because they're sicker baseline or didn't have the healthcare even before the pandemic, but partially because they really need to work. Asking these people to take 2 weeks off work is it feels impossible to them. They're living in closer quarters, and so it's hard for those communities, and it's really sad. When you tell someone to go home and quarantine, they're like, "Well, I live with like 6 other family members.
Right,
Where am I supposed to quarantine in an apartment?" And that's really difficult. And I don't know how to help in that sense. Like, how do you get somebody extra space or extra housing? And I don't even want to speak to the economy because it's such uncharted territory. And I know that there've been different stimulus packages to help every community, but it's hard to have to work and not be able to take 2 weeks off but be forced to for health reasons.
Yeah, I mean, and there's also, not only just the taking weeks off for work, but the fact that we closed the schools down as well.
Oh, yeah.
There's childcare issues associated with it. And then, I know that when we were first talking about closing the schools down and whatnot, it got into like, how do we feed the families that rely upon the school system for both their lunch and their breakfast for at least 2 meals a day? And, we went through feeding processes, and a friend of mine who's a fifth grade teacher, he worked hard with getting food. The go bags, right? So they made actually like brown lunch bags and stuff like this. So there's a lot of decisions that are being made into and how to make this thing work properly. And I know that this kind of goes into also treating patients as well. I want to talk about masks for a second, right? And I don't know how masks became controversial, but for whatever reason they are. I know that when the mask thing first started, people were going out and getting the N95 masks, and I was kind of wondering how that was going to work for everybody, because I remember when I was in the medical field, we had to do the fit testing, right?
Right.
Sure, you don't just slap a mask on and it works for you. And then I know we have mixed messages coming from both the federal and state and local governments, for that matter, that when this first started, we told people, no, masks are only for people who are getting close contact with them. That's for the medical providers. Don't wear masks. And then somewhere along the line, there was a shift, and then we went from not wearing masks to recommending people to wear masks. First of all, what kind of masks should people be wearing if they're going to wear masks, which they should be wearing, I think? And then why is this like all this stuff coming in, like where people go, oh, if I use the mask, I'm going to get sick from my own, breath. I don't understand where that really.
Yeah. The media, social media, all, you have to be so careful about what you read. So I think what happened initially, and again, I'm not on the inside of any of this. This is just kind of like a bird's eye view from what I've interpreted. But, initially there was the concern that like, we don't have enough PPE for the healthcare providers. So I think that's probably maybe where the initial, like, we don't need the mask issue came up. And then also partially because like those generic blue masks, even the fabric masks, like they'll protect you against large droplets. But the reality is like, unless you're wearing an N95 or some other like very high grade mask, you're still at risk for getting COVID if you're, close enough. So the idea then where we transition to, well, everyone now needs to wear a mask, like in the public, like when you go out to the stores, was just to stop the like general droplet spread. But the reality is, you can tell, right? You have like little sides to that like air still gets through. It's not going to protect you against everything. But I think the thought is like, if you protect others by your spray, and then simultaneously somebody else does that for you, it's more protective than nothing at all. Compliance with it has been, I think, a hot topic I think because the medical community has been very confusing to the general public. You know, we say don't wear the masks, then do wear the masks, and you have kind of some of these like split ideas and ideologies. I think, you know, the reality is if it makes people more comfortable, if it's state mandated, you know, wear the mask. There's really no harm in wearing the mask, I guess, and unless you have some other like medical condition that for which you've already discussed with your physician. But you know, everyone's trying to do their part. I know as a healthcare provider, you know, trying to make our jobs easier, just in the sense that like we don't want to see you in the ER. We would love for you to not be sick. So if that means like just abiding by the state mandates or doing your best to protect your own self, that helps us, because we would love to see you in the community and not in the ER.
Right, absolutely. Yeah, I mean, it's, you know what? I mean, we've gone through this as the collective we as a nation. We've gone through this before. You know, World War II, everybody did their part, right? I mean, there are people who, you know, didn't have cars. They took their tires off their vehicles and donated the tires to the war effort. Women didn't wear stockings, you know, because that all went to making parachutes. You know, there's stuff that we did to sacrifice as well. And, you know, I mean, I think wearing a mask is it's just a small thing that we could do to make sure everybody's kind of collectively into it. We're going to take a break here in a couple seconds. And, but we come back, I really want to discuss the idea of vaccines, where we're at with them, and then why some people don't want to take them.
Okay.
So,
Weekly.
Seconds count during an emergency. That's why at Titan HST, we're always inventing new technology to help people stay safe and help people who can provide help get connected with people who need help. At Titan HST, we've deployed mesh networking, allowing emergency communication even when networks are down, augmented reality, and real-time translation. We believe in the power of people to help each other stay safe and thrive.
Are you looking for that bag to help you keep organized as you travel around, something you can carry with you every day? Well, VanQuest was founded with a simple mission: build the toughest bags and packs for you to carry every day and to help you stay organized and prepared. VanQuest has been making the ultra-durable bags and packs since 2011, and their bags and packs are trusted by clients such as the FBI, the U.S. Secret Service, and U.S. SOCOM. Yes, that is the U.S. Special Operations Command. Their bags and packs offer the best organization for the user-friendly experience, such as the high visibility interior for the users. And I'm telling you something, I love that orange inside the bag because I could find the things I need quickly. I love my VanQuest bag. Don't forget, they offer free shipping, 100-day return guarantee, and a lifetime warranty. And if you put in EM Weekly, all caps, all one word, you get 10% off your total purchase. VanQuest.com. Hey, Brian, still there? Oh, he left me. You know, it's I have a friend of mine who is going to be running for the IAEM second vice president position. His name's Brian Scroggin. And him and I, we went to the Executive Academy together over in Maryland. He's a great guy. And he's actually been involved with emergency management on various different levels. He actually... He now works as the Deputy Director for State and Public Charter Schools and Authority in Nevada. I work with 65 schools, 50,000 students, and he develops their operations and emergency management plans for those schools. And Brian also is really involved with volunteer organizations. And as a matter of fact, he responded to the shooting in Las Vegas, if you guys remember that shooting. And it was just he's an amazing guy. So I'd like to say I'm going to support Brian for his election for the IAEM second vice president. So Brian, good luck, and maybe we'll have you on the show sometime. So yeah, it's kind of neat. I think that as emergency managers and the people that are really public safety minded, we get involved in a lot of different things, and I know that you're involved in a lot of different things as well. But I'd like to talk to you a little bit about the vaccines. So I was reading the Wall Street Journal that there's a vaccine that looks promising. Do you know much about that one?
I've seen a few pop up from Moderna, and I think, Johnson and Johnson. Everybody's kind of trying to. I think as soon as they have like some sort of progress, there's like some sort of publication that gets put out, like, "Hey, we're closer," which is encouraging, I think, to the general public, because the thought behind, okay, the vaccine will save us, and I think even when the vaccine is finally here, it'll take some time to vaccinate everyone. It'll take some time to kind of like, even still, it's not going to be, I think, an immediate fix. It'll take probably some time to even get to that point where people are vaccinated enough to achieve herd immunity. So, I think it's all encouraging. I don't know anything more than that. I'm not really on that side of things, but I look forward to the days of a vaccine for sure.
Yeah, I know that when this originally broke, and we were discussing vaccines in general, and I know that we're talking, I mean, realistically, it takes about 18 months. Fast. Like that's like super fast. That's like lightning speed going fast for these scientists to create vaccines or any kind of medication at that time. And then now you have to go into human trials and stuff like this. But I'm reading now on the sociological side of things that there are specifically minority groups at this point are very suspect to being on that first round of vaccines. And there's a lot of pushback on this. Why are we seeing such a pushback on these treatments that might be coming out? Why are people afraid to take them? What's going on out there that's creating this fear?
I think that there's probably a lot of fake and false information out there. So I think that contributes to it. And I think sometimes, especially if you're not in the medical field, it's hard to piece out like what's actually real and what's not. So I think that contributes substantially. And I know that, various platforms are trying to kind of minimize the amount of fake news and fake information out there, but it's hard, it's hard to even do that. There's just so much information. I think inherently too, there's I'm sure some sense of maybe even mistrust within the government or within the healthcare system, even in how this pandemic evolved, and like the various kind of opinions about how to go about the pandemic probably makes people a little bit more distrustful too. And so when I think it comes to vaccines, it's just another reason why people might just be more distrustful of like, okay, is this really going to work? People have had varying opinions even throughout it. Like, should I trust the vaccine? So maybe that's the thought process. I don't know, because obviously, in general, for all kids, they basically have to be vaccinated to be part of the public school system, unless there's, certain special cases, whether that's like a health condition or maybe for religious reasons, but in general, most children are vaccinated. I know that, there was that horrible study that was retracted, that vaccines cause autism. I couldn't be a bigger promoter of vaccines. There's a reason why you don't see measles, mumps, rubella. I mean, now we are, unfortunately, because people haven't been vaccinating. But I'm such a huge believer in that. Like, there's a reason why we don't see polio anymore. Those are horrible diseases. And so to the same extent, like when the vaccine comes out, I definitely will be getting the vaccine. I'm going to be promoting that to my patients and to, my own friends and family. But I'm a huge believer in vaccines, just because, you see the other side of it, from our standpoint, and, we've come really far as a society. And I think that's been a large part of like us, living longer, having better healthcare and health in general is listening to the scientific community in terms of like what's been proven. And there's a reason why these vaccines take 18 months, like it is to protect, people. Mm-hmm. And so, I'll be a big promoter of vaccines when they come out. And to this day, I very much am.
I agree with you. And I mean, I have to admit that I am really bad with taking my flu shot. And I have been. I was forced to do it for a long time.
Yeah.
But it's my thing is I just don't like getting shots in general. It's not that I'm afraid
I
of
know.
it. It's not like really keen on people sticking things into me. But no, I agree with you though, and I will be, if I'm allowed to be, one of the, I'll be in line to get this vaccine because I believe in it, and I believe that we need to do our part, and a little bit of the herd immunity coming in here. There's a question here: how many companies are presenting a vaccine solution or working towards a solution?
I mean, I think realistically, I keep seeing a lot of the same names, so I would guess probably, at least 20 to 50 is my guess. But I'm not in that area of medicine.
Right.
I know that a lot of companies have pivoted just in general to facilitate whatever it is they can to combat the pandemic, whether that's vaccine formation, PPE. I mean, you have fashion companies making masks, things like that. So, I mean, I know Johnson & Johnson, I think I read, was even, I don't know that that's even their main focus usually are vaccines. And I think they've been involved. I mean, there have been so many pivots within medicine and science. So it's hard to say, but I know that things are definitely progressing, especially with some of the companies I've been reading about, Oxford, Moderna. So I think it's encouraging. I like to think that, January 2021 is hopefully going to be a good month for us. I hope. But
yeah, I hope so too. I really do. I mean, I think vaccines are scary, right? And when I say this, it's like, not vaccines, I'm sorry. Diseases are scary because like as you fire, you can see it, you can fight it, you can get away from it, excuse me, things like that. Right. But when it comes to something that's just in the air that you can't feel,
right.
touch, or see, it's kind of like you don't know what is safe and what isn't safe, and getting that vaccine, protects you from that. It's kind of like putting on that suit of armor, or whatever that's going to protect you. So I think it's really well worth doing it. And I applaud the scientists that are working on creating these vaccines right now. And, it's a lot of hard work. Well, we're coming here close to the end, and I just want to talk about you for a couple seconds here. So tell me a little bit about what you're doing right now and some of the things that you're working on.
Yeah. I mean, while I don't work in vaccines, I feel like I feel so thankful that I feel like I have the best jobs in the world. So, I'm obviously an ER doctor. I intubated someone this week for COVID, but I think one of the most important parts that I play just as an ER doctor is the health literacy and the education, because I want to reassure the public that, I'm working currently on the West Coast. I'll be back on the East Coast soon, but 95% of who I see in the ER discharge, and they do well. It takes, some time to get over the virus, but part of what I love about my role as an ER doctor is I think reassuring people that things will be better than I think they think, and better than what they read in the media. So that part of my job I love. On my days off, I still work for my artificial intelligence company, Centaur Labs, and we've been working as much as we can. We've tied it a lot with my role at the Brigham that's starting here in the fall soon, but we're trying to help other companies and other university systems develop AI models to improve diagnostics within COVID. So that means, are there things that we can catch that might be more prognostically indicative of, is this patient going to do better or worse with COVID? Should we be admitting them longer? Should we be watching them longer? And so our company helps facilitate cleaning and annotating that data, like large sets of data, to build out the AI models.
Sure.
So from a researcher standpoint, it's been very meaningful work because I get to see this every single day and say, hey, this is the reality of where we're at as a community in medicine. And then on my days off, I get to go and actually like be a part of the change that we're hopefully going to impact, whether that's for me on my day job, as an ER doctor, like knowing which tests to run and to order, or, which patients to call back or which patients to watch more closely. I love that I get to be part of both worlds, from the scientific, research community, but then also from the clinical side. So, I mean, we couldn't be more invested as a community, I think, in trying to beat this, because we, just as much as everyone else in the public, don't want to see people in the ER with it. And we want people to do well. And to go back to as normal as we can as soon as possible. And so, I mean, so many of my colleagues are also working long hours just to try to, whether it's the vaccine or not, trying to improve whatever we can for our patients moving forward, to get back to normal.
Absolutely. We are definitely in a full court press when it comes to trying to beat this thing. And thank you so much for being on the front line and doing what you do. And thank you for your company doing the AI stuff. I love technology and how technology and artificial intelligence can help us make better decisions. I think that's really important work.
Yeah, I think it's exciting. I mean, there's so many bad things about the pandemic. I think there's also so many silver linings. And I think part of it will be, who we inspire, who our children will be. Like, can you imagine being a 10-year-old right now and seeing all of this and being like, I want to be a scientist. I want to be a doctor. I want to be a NASA astronaut. I think there will be a lot of good that comes out of it. And I think AI is part of that. You've seen a lot of companies pivot and really put a lot of attention into AI. And I think that's going to facilitate a lot of technology and how that integrates within medicine moving forward. And I think that's how we're ultimately going to get to the end of this as soon as possible.
Absolutely. Well, Doctor, thank you so much for your time today. And I know that you have a lot of work to do, and thank you again for being here with us on this Thursday morning. And hey, everybody, thank you again for also y'all being here with us, listening to what we're talking about. And don't forget, follow us on Facebook, your favorite podcast player, YouTube, Twitter, and of course, join us next week. And as Mackenzie likes to say, stay hydrated.
Thanks for having me.